What's going on, everyone? Eder Garavito here, founder of ScholarNet. Sorry, restarting that. What's going on, everyone? Eder Garavito here, founder of ScholarNetics 360 and your newest co-host at the Healthcare Education Transformation Podcast. I'm excited to join this team and really can't wait to bring you all fantastic content on the healthcare education landscape. But for today's Teach Me Something Tuesday, I want to focus on and talk to you all about motivational interviewing. So, motivational interviewing is a strategy that we use to speak to pretty much anybody that we're interviewing, right? But this strategy was specifically developed by clinical psychologists William Miller and Stephen Rollnick, and it actually was developed for the healthcare landscape to enhance an individual's motivation to change, right? So oftentimes as clinicians, we find ourselves having conversations with patients trying to motivate them left and right. And sometimes we feel stuck. And truth be told, when we are teaching how to interview patients, like a subjective interview in a didactic coursework, like in PT school, a lot of times students leave with this sort of like robotic subjective interview template. And I hate that, right? We have to make sure we tailor our interviews to the specific patient. And essentially, I hate to say this, but oftentimes we're sort of like salespeople. We have to sell our service or why we're trying to help the patient in order for them to participate. And if you just listen to some of these strategies and try to really implement them into your practice, either as a clinician or as a learner, I really hope that you'll be able to get more out of your patients and that you'll be able to you'll be able to communicate with them even better. All right. So there are some principles of motivational interviewing. The first one is for us to express empathy. Now, this doesn't mean we have to be pouty and always just like on the patient side. But expressing empathy while we're communicating with a patient really just speaks to us understanding and validating the patient's feelings and their perspectives without judgment. Now, nobody's perfect. I'm not perfect. I can't sit here and record this and tell you that I've never judged a person or a patient. But if we're able to just express ourselves verbally without being judgmental, that's going to build a trust and create the safe space for the patients to navigate a little bit deeper into their thoughts and their feelings and share them with you. Okay. After that, we want to make sure that we develop some sort of discrepancy. We want to help the patients recognize that there certainly is an inconsistency between perhaps their current behaviors that they're exhibiting and their broader goals and even their values. Okay. So if we offer them that perspective, that can potentially motivate them to start making those changes. The next one is something I want all of you to listen to closely because, again, I'm not perfect and sometimes I get frustrated too. But no matter what a patient says to you, or a partner, or if you're interviewing somebody on a podcast, you have to roll with resistance. Okay. So you have to be accepting and work with the patient's resistance instead of confronting it directly. If we don't confront directly their resistance to whatever we're trying to recommend, even though the literature perhaps says that that's the best thing for them and you believe that it is, then that's going to reduce any sort of defensiveness and keep the conversation productive, which is super important. Okay. And the last part is supporting self efficacy. So we want to make sure that as we're communicating with patients, we encourage them to believe in their own ability to make and sustain changes. It doesn't have anything to do with what the literature says or what we think they can believe. We want to do this by affirming their past successes and perhaps any strengths that they've shared with us. So, what are some skills that you can use to be able to implement these strategies? The core skills, as they define, as our psychologists define them, are oars, like an oar, like you're, on a lake in a canoe. OARS. So, the first one, use open-ended questions. Now, I know that hopefully many of you already know this and you've been told this a lot, but I challenge all of you, whether you're a student or clinician, to just reflect on your subjective interview and the types of questions that you're asking. Maybe keep a tally and think about, are these really open-ended questions or not, right? If we want to get detailed information from a patient, we want to be able to offer them this open-ended question, such as, I don't know, let's say like, can you tell me a little bit more about your goals for physical therapy? I can't tell you how much I dislike when students are taught to say something like, what are your goals for physical therapy? Heck, I wouldn't know how to answer that if I'd never been to physical therapy myself. So, can you tell me a little bit more about your goals? And if their answer is whack, then you redirect them, right? And so perhaps another strategy for an open ended question, you could ask, what are some challenges that you have faced in sticking to your current exercise or treatment plan? We might know what they are. We might, read their notes. We might communicate with our colleagues, but we want to see what their perspective is. With the For the A of ORs, affirmations, it's huge. Okay, we want to offer them positive statements that are going to help them recognize their efforts and their strengths. It doesn't matter if you think they're huge or small, or you like the patient or not. We need to make sure that we have statements of affirmations. For example, you know what? You've shown a lot of dedication to your exercises, which is fantastic. Even if that change is minimal, we want to make sure that we affirm it. The R in ORS, reflective listening. Please, if you find that you are talking more during a subjective interview, whether it's in practice with your classmates or in a clinical setting, than the patient is or your partner, you're wrong. I'm just telling you that right now, unless you're educating, right? We're doing an interview. We want to actively listen. So we want to actively listen and then try to paraphrase what they have said to you. And we want to do so by showing that we understand their perspective and that we are empathetic. For example, we might say something like, you know what? It sounds like you're feeling frustrated because you haven't seen the progress that you have hoped for. Internally, as clinicians, we might be thinking, you haven't seen the progress because you're not doing what I asked you to do. Now, we're rolling with resistance, right? But we're asking them just like, look, you're telling me these things, and perhaps I think they're whack. I don't know. But I'm still going to ask you. I think you just haven't seen the progress that you've hoped for. And I see that you're frustrated. So let's work with that emotion. Let's work with that feeling. What will make you feel less frustrated? And the last part of ORS is summarizing. So we want to make sure that we are able to summarize the patient's key points or your partner's key points to make sure that we understand and that we have demonstrated to them that we are listening. Okay. Now, I urge you to not just repeat everything that they said, like somebody's repeating your McDonald's order, but you're going to hit those key points and you're going to demonstrate that you've heard their chief complaints and you're going to tell them that, and you're going to demonstrate that you've also heard perhaps their perspective on therapy and on something else, right? And so we might do so. Something that can help, clarify and reinforce important aspects of the conversation is having the ability to just fluidly speak to them as opposed to listing things. This is what you said. This is what you said. Things like, look, I get it. Therapy isn't your jam. And you know what? At the end of the day, sometimes I don't want to be here either as a clinician, but let's be real. You're young, perhaps, right? You have these goals, these aspirations, and I can help you. So let's work together, right? So when you're speaking to patients, you want to make sure that you use something called change talk. Okay. So how do we identify this change talk? We want to listen for, and we want to make sure that we also recognize any statements that the patients make that share some sort of a desire, an ability, or a reason for them to change. Again, our reasons for wanting them to change might be completely different. Our reasons for them to change might literally be this is to save your life. But for them, it might be different. So, for example, you might say something like, they might say something to you, such as, I want to be able to play with my, I don't know, dogs or grandchildren without pain. What you've heard there is a desire. I want to be able to do something without this discomfort or this pain, right? Now, as they're speaking to you through the subjective interview, they might say something such as, I don't know, you know what? I know that I can stick to the exercise plan if I actually set my mind to it. That's it, giving you that's you are at that point, identifying the patient's ability. Okay. So then we're going to now take that change talk and we're going to evoke it. So we're going to ask them questions and we're going to do so by making reflections that are going to hopefully encourage them to talk to us a little bit more about their own individual motivations for change. Now, at this point, we've already established trust, right? We've been empathetic. So, for example, you might say something like, what would the benefits of completing your physical therapy home exercise program be? We know what they might be, but we want to know their perspective. Or something else might be such as, you know what? How would your life be different if you were pain free? Because it's a possibility. Now, it's not going to be easy, but how would your life be different if you were pain free? So I challenge you all to practice these strategies as you're doing some, perhaps practice in classrooms. Perhaps you're starting to do some patient interactions as a student in clinical rotations. Perhaps you're a clinician, a new clinician, or a clinician with 20 years of experience. Remember, we want to make sure, just to summarize, that we express empathy, that we develop discrepancy, that we roll with the resistance, and that we support the patient's self efficacy. Now, the core skills are oars, like you have an oar in a canoe. We want to ask open ended questions. We want to offer affirmations. We want to offer reflective listening, and then we're going to summarize everything. And the last bit is change talk. Remember, we're going to identify those just change talks, such as, are they speaking about a desire, an ability, or a reason for change through their responses to me in their subjective interview? Then we're going to evoke that change talk and ask them questions that might have them reflect. Remember, like, how would your life be different if you were pain free? All right. I hope you accept this challenge. Practice this. Stop being so monotonous. If you feel like you are, stop being so robotic in your subjective interviews and go out there and make a difference.